get an impression what is this surgery? Can anybody name it? What is the surgery going on? Tonsillectomy. What is this thing? This is an endotracheal tube. If you see any patient having this kind of tube, that means this operation is going on under general anesthesia. Okay? So, first question will be asked, what is this? This operation is tonsillectomy and it is done under general anesthesia. Right? Now, after this general anesthesia, okay sir. So, we will proceed for the surgery itself. We will take a separate class about the position of the patient, how to perform the surgeries and all. But look at this instrument, okay? This instrument is known as what? Not oral retractor. Specific name, it is Boyle Davis Mouth Gag. Right? At least 50% students will be given this instrument in exam. Okay? It has two parts. This part and this is the tongue blade. Okay? Of different size depending upon the mouth opening. For pediatric, small one, and the adult, bigger one. Okay? So this is the Boyle Davis Mouth Gag. Right? If you are good enough in exam, examiner can ask you which part is Boyle, which part is Davis. It's not written in the book. Just to remember this, this is D-shaped, right? So this is Davis. Okay. So what are the surgeries it is used? One is tonsillectomy. Everybody should utter this one surgery at least. Okay. But we can use it in any other surgeries, in oral cavity, in oropharynx. Okay? Okay. Or in palate, right? So oral cavity, palatal surgery, surgery of soft palate, pharyngoplasty, tonsillectomy, and also in adenoidectomy. Sometimes in angiofibroma, when we go for a posterior nasal space approach, okay, or transpalatal approach, sometimes it is also used. But at least tonsillectomy and adenoidectomy should be the answer. Okay? Which surgery cannot be done? Which structure? Oral cavity te ekta structure jeta surgery eta diye kora jabe na. What is this? Any idea? It's a common sense. Look at this. What? Tongue. How can we operate on tongue? Because tongue is retracted. You are placing the instrument on tongue, right? So you cannot operate on tongue. Okay. And with this instrument, this kind of instrument is also used, okay, to fix it, to have a stability during surgery so that it does not move. These are all separable. We call it Draffin's bipod and Magauran's plate. Okay, right? We'll show you this instrument. This is a mouth gag. যেখানে টাঙের সার্জারি বয়েল ডেভিসে করা যাচ্ছিল না, we can use this mouth gag to just open it up, our mouth. Okay, we call it Doyen's mouth gag. Doyen এর নামে অনেক কিছু আছে, আছে তো? Doyen's retractor, আছে তো? Okay, so this is Doyen's mouth gag. Okay, what? Doyen's mouth gag. Okay, so common sense, কোন সার্জারির জন্য এটা ইউজ হতে পারে? Any intraoral surgery, any surgery in tongue, any surgery in your floor of mouth, buccal cavity. Okay, you can use it. Okay, so oral cavity surgery in short. This is not generally asked, but just have the name. It's Jennings Mouth Gag. Now, this is another important instrument for tonsil. We call it Tonsil Holding Forceps. If you are British enough to utter this, our scientist's name, it's Dennis Brown Tonsil Holding Forceps. right? We hold the tonsil, we retract it medially to have the access on the tonsillar bed, right? Tonsil take tene dhorle tobe to we can operate on tonsil, right? So this is very, very important instrument, okay? Tonsil holding forceps. How to identify it? এই দুটো ব্লেড more or less একটু ছোট বড় হয়, okay? So that we can have a better grasp, right? And there is no joint, তাই তো? So that it's easily open it up. We can adjust it accordingly. Joint থাকলে কি হবে? It will lock. So it will be fixed, okay? So this instrument does not have a joint. কেন বললাম? Because similar instrument আরেকটা রয়েছে which has a joint, okay? So Jennings Brown, we use it to hold the forceps, okay? Yes? Yeah, catch. This is tonsil dissection forceps, okay? One is having a tooth, other one is plain forceps. Sorry, this one is having tooth, this is a plain forceps without tooth, right? Tooth is for holding tougher tissues like skin and all, okay? And important, suppose that there is a definite vessel, we hold it sometimes with catch. But for most of the soft tissues, we use the plain forceps, right? And this forceps for tonsillar dissection purpose, this is a very long type, long and slender, right? So this is tonsil dissection forceps. The British name is Waugh's tonsil dissection forceps. This is another very important instrument, this tonsillar pillar, okay? This end is to retract the tonsillar pillar, okay? And this one is for the dissection, okay? So in combination we call it tonsil dissector and anterior pillar retractor, okay? So with the name you can understand, one end for the dissection purpose, we dissect the tonsil with one end, and another end is for retraction purpose, so that we can retract the pillars and identify if there is any bleeding vessel or not, okay? What is the commonest complication of tonsillectomy? Most important? Bleeding, okay? Don't forget it. Tonsillectomy means there is chance of bleeding, okay? This is a straight artery forceps, okay? Straight artery forceps, we call it tonsil artery forceps, okay? Long and thin straight forceps. And the curved one, this is for Negus, we call it Negus. It is, what is the purpose of this? Having, if you use the common sense, what should be the purpose of this forceps? To hold the catch the bleeding vessel, okay? So if there is any bleeding, we just catch it. Then we pass the Negus underneath so that we can tie it, okay? So both of these forceps are used to ligate the bleeding vessel, okay, for hemostatic purpose. This is a suction, we call it Yankauer suction cannula, okay? This end is not atraumatic, right? So that we do not trauma the tonsillar bed. We suck it up, it has perforation in the anterior end, and we traumatize the tonsillar bed. This is a snare, okay? We call it tonsil snare. After dissecting the tonsil, we just pass it and we just snare the lower pole of the tonsil, okay? The most important bleeding vessel is in the lower pole of the tonsil artery, okay? So to catch it, to snare it, anyone? Lots of humming. Any question? Okay. So we use sometimes the tonsil snare, okay? It depending upon which method of tonsillectomy we are using, okay? Suppose for me, I use the coblation technique, I need only one instrument, the tonsil holding forceps, okay? But if you do the dissection method or snare method, you may need all these kinds of instruments, okay? But obviously in your exam you will be asked about the dissection method, the traditional and time tested method. Okay. This is for adenoidectomy. Okay. Very important. This is frequently asked. St. Clair Thomson Curette with and without guard. Okay. This one is without guard. This is with guard. This guard, cage-like structure, it's separable. You can separate it out. Okay, detachable, right? Okay, you can detach it. And this cage, this one is just for to curate the adenoid, and this cage is just to hold the tissue so that it does not get into other places like larynx and all. Okay. Okay. So in exam you will be asked again how to hold this instrument. Okay. First question will be to identify the instrument. Next question will be how to hold the instrument. Third question will be what are the uses of the instrument. The uses you tell, you will be asked the questions accordingly. Suppose you are telling in tonsillectomy, then you will be asked about tonsillectomy, right? So this is the art of giving exam. How you need to draw your attention to the things that you have read properly. Okay, draw the examiner's attention, right? So if you know the tonsillectomy, you have to tell tonsillectomy as an indication, then examiner will ask about tonsillectomy. Okay. Now coming into septoplasty. Okay. This is Asch's septum forceps to septal fracture or septal dislocation in trauma. Are you following me? Following me? Okay. Suppose you are having a septal dislocation, nasal septal dislocation or nasal septal trauma or fracture. Then to straighten it up, to reduce it, we use this forceps. It is Asch's septum forceps. Okay. Another one is Walsham. This is to correct the nasal bone. Okay. So নাকের ভেতর ঢুকিয়ে একটা end আর একটা end দিয়ে nasal bone fracture reduce করার জন্য. Okay. Got it? This is Asch. The arms are little bit longer and mild angulation is there. Okay. And here it is mostly straight. Okay. And it's smaller. The blades are smaller. Okay. So this is Walsham. Walsham and Asch, right? Next, this is a very, very important instrument. Even in OPD also we use it frequently. Okay, this is a forceps. Okay, specially built forceps. This one is Hartmann forceps. Sorry, this one is Hartmann forceps. Okay, and this one is Tilly's forceps. Right? এই সামনের দিকটা দেখ. Can you see it? It's straight. No caricature is there in Tilly's. But in Hartmann it is, there is a serrated end and little bit what? Huh? No, it's not angulated, it's little bit wide end here. Okay, there is a tip here. Separable tip. I mean, you can appreciate it separately. Right? So, there is a tip kind of না দেখালে খুব মুশকিল. ওকে, একটু সামনের দিকটা ফোলা, right? And these joints are little bit different. Can you see? Little bit different. Okay, এটা একটু longer হয়. This one is little bit longer. This is little bit shorter. Okay, joints are little bit different and the ends are different. This one is Hartmann. This one is Tilly's. This is mistaken. Okay. This is an OPD instrument, thudicum speculum. Okay, definitely you will be asked how to hold it. What is the instrument? OT theke we will show you how to hold it. Okay. So what is the use? Sorry, I forgotten. What is the use? This is used for mostly ER purpose. Okay, ER toileting, ER packing, ER foreign body removal, all these things. Which one? Which one? Hartmann. Okay. And Tilly's one mostly used either in nose or in oral cavity. Nasal packing, all kinds of nasal packing we use it. Sometimes we use it to remove a foreign body in nose. Suppose there is a fish bone in your tonsil, we use it to remove that, okay? To do any kind of manipulation in your nose and in oral cavity, we use it, okay? But if you are asked about one use, that would be in nose, in nasal packing and nasal surgeries. What are the nasal surgeries? All the surgeries, septoplasty, face, okay, SMR, right? All the surgeries we use it, okay? Thudicum nasal speculum, what is the use? It's a nasal speculum. Nasal speculums are used to see the anterior nasal cavity. We call it anterior endoscopy, right? We use it to do other diagnostic purposes, therapeutic purposes as well. So every instrument has some diagnostic use, to diagnose something, and to therapeutic use, just to remember it better, okay? This classification has been done, but mostly Thudicum nasal speculum is used in all kind of nasal surgeries, again, okay? Especially in septoplasty, SMR, all these things, if you want to remove a foreign body, okay? If you want to give a nasal pack. So this is a nasal instrument, right? This is again, it is a Killian's nasal speculum, okay? This is also used for the same purpose. It has a better grip, okay? It's mostly in the surgery we use it. Killian's long-bladed nasal speculum. This is a nasal gouge and hammer, Cheni Haturi. Where we use it? Gouge and hammer in septoplasty surgery, right? In septoplasty, there are bony part of the septum. So we sometimes fracture it, reposition it, excise it, remove it, lot of things. For that purpose, we use gouge and hammer. Okay. This is a nasal snare. Doesn't need. Lark's forceps. This is being confused with tonsil holding forceps. Okay. So, bhalo kore chobita dekh. Okay. And I am going to the tonsil holding forceps. See the difference? What are the difference? First of all, এই ব্লেড দুটো ছোট বড় হবে একটু, উপরের পার্টটা একটু ছোট হয়, নিচের পার্টটা একটু বড় হয়, ওকে? Again, anything else? The joint is completely different, right? That one is box joint, this is a simple joint, okay? Our curvature different, shape ekটু different, but frequently confused, okay? The Lark's forceps. Lark's forceps is used for, frequently used for nasal surgeries, right? Okay. And mostly because if there is a polyp, there is something, a mass there, we need to resect it out, right? It's a gross thing. Just if there is a polyp, we just hold it and resect it out. For that purpose, we use Lark's forceps, removing the bone during surgery. So mostly during nose surgeries, nasal surgery. Sometimes we use it in throat surgeries as well. This, after all, it is a forceps, okay? But the most important use is nasal, this especially in polyp and neoplasm, and as well as in septoplasty, okay? During septoplasty, sometimes we, with this Lark's forceps, we fracture the bone and cartilages and all, okay? Okay. So, another instrument. This instrument is used in nasal surgery and as well as in ear surgery. Okay? Namta bhalo kore mone rakh. This is frequently asked. It's Freer's perichondrial elevator. Freer's elevator. Okay? Mostly we use the perichondrium, sometimes the periosteum of a bone or cartilage. Right? Perichondrium means chondrium, cartilage covering. Osteum means cover up bone. So in ear surgeries or in nasal surgeries, we use this instrument. It's a part and parcel, very important instrument. Okay? we use it. Again, jeta bhul chilo age, okay? This one is Tillis, this one is Hartmann, right? This instrument, extremely important. Okay, this is known as Mollison's self-retaining hemostatic mastoid retractor. Okay, the name signifies everything. Okay, first of all, it's a mastoid retractor used in ER surgeries, mastoidectomy, tympanoplasty. The bigger version is used in all kinds of surgeries, right? A mastoid retractor বড় সাইজের হলে it is used in neurosurgery, in spine surgery, in brain surgery, okay, because of its excellent qualities. We developed this instrument and everybody uses it, right? What are the qualities? First of all, it's self-retaining. Self-retaining মানে কি? যেমন ভাবে রেখে দেবো ক্যাচ মেরে সেরকম ভাবে থেকে যাবে, okay? Next is hemostatic. What do you mean by hemostatic? স্ক্যাল্প বা ফেসের বা যে কোনো স্কিনের যেগুলো আমাদের অত্যন্ত ভাস্কুলার জায়গা, হেড এন্ড নেক ইজ এক্সট্রিমলি ভাস্কুলার, তাই তো? স্ক্যাল্প হ্যাজ লটস অফ ভাস্কুলারিটি, সো উইথ দ্য সেলফ রিটেনিং প্রপার্টি the edges, suppose the cut margin edges are having bleeding, okay, একদম মার্জিন থেকে খুচরো খুচরো ব্লিডিং হচ্ছে, okay, we just put the retractor and it stops the bleeding there. So hemostasis is a very important quality of this instrument, okay? So it's a self-retaining, it's hemostatic, and it's used in mastoid retractor, that means in ER surgeries. So ER surgeries গুলো নাম বলে দিলেই হবে, প্রত্যেকটা ER surgeries this instrument is used, okay? Name some ER surgeries. Call it mastoidectomy. Why are you inviting troubles? If you are asked what are the types of mastoidectomy, then you tell canal wall up, canal wall down, all these things, okay? So in mastoidectomy, in tympanoplasty, in simple myringoplasty, in sepidotomy, right? Others lateral scalpel surgeries, okay? So it is অত বলার দরকার নেই, tympanomastoid surgeries এর নাম বলতে পারলেই হলো, okay? If you are confident about otosclerosis, sepidotomy, then utter this word, okay? And if you are confident about the types of mastoidectomy, then utter canal wall up and canal wall down, okay? পারবি যদি পারিস তাহলেই বলবি, otherwise you are inviting troubles, right? So বোঝা গেল, okay? There are other varieties of these retractors as well, but this is being asked, okay? It is Lempart, this is Jansen's, these are the things, these are also used. This one, আগেরটা কি ছিল, কি এলিভেটর? Frears perichondrial elevator, তাই তো? This one is periosteum elevator. It's Farabaug's periosteum elevator, okay? তো periosteum কোথায় তুলতে হয়? During ER surgeries, okay, we elevate the periosteum from the mastoid bone, so it is used in mastoid and tympanoplasty ER surgeries, okay? কিভাবে ধরা হয় সেটা ইনস্ট্রুমেন্ট না হলে তো দেখানো মুশকিল, but this serrated this thing to place the thumb, okay, and এটা দিয়ে just press করে ঘষে ঘষে periosteumটা তোলা হয়, okay? So this is also important instrument. This is curette and scoop, nowadays not used, it is also used in ER surgeries, okay? Lempart, curette and scoop. Gouge আগেকার যুগে ইউজ করা হতো, mastoid gouge, okay? So for mastoidectomy purpose we used to use this instrument. Nowadays we are using high speed drill, okay? This is another instrument, myringotome, very important, okay? Myringotome means what? Make an incision in the tympanic membrane. So myringotomy কোথায় করা হয়? Next question will be asked, okay? কোথায় করা হয়? Now myringoplasty is already there is a perforation. Perforation আবার কি perforation করবি? You are making an opening in the intact tympanic membrane, that is myringotomy. CSOM কেন করা হবে? CSOM means what? That means yes, there is a perforation. So intact TMA কোথায় myringotomy করা হয়? Incision. Sometimes in complicated ASOM, তাই তো? And most commonly done in grommet insertion, okay? we make a myringotomy and we insert the grommet, right? Okay. This instrument already সকালে পড়ানো হয়েছে. This one is tongue depressor, lax tongue depressor, right? This one is, this is to hold it here, okay? You need to hold it here, and this one to depress the tongue. Right? While depressing the tongue will be inside your mouth, right? Not outside. জিভটা বার করুন বলে তুমি এটা দিয়ে প্রেস করছো, there will be trauma, okay? So what are the uses of this tongue depressor? Make common sense. Diagnostic purpose. What diagnostic purpose? To examine the different parts, right? What are the parts? Oral vestibule. Next. Part of the tongue, oropharynx, tonsils, right? Palate, right? Floor of the mouth sometimes, okay? We can examine with that, okay? Floor of the mouth examine করতে একটু কায়দা করতে হবে, but we can examine with that also, okay? আর other examination, posterior rhinoscopy করার সময় ইউজ করা হয়, right? We depress the tongue and we introduce the posterior rhinoscope mirror and we do the posterior rhinoscopy, right? সকালে পড়ানো হয়েছে, পরের দিন ইনস্ট্রুমেন্ট দেখানো হবে, তখন আরো ভালো করে করা হবে. আর থেরাপিউটিক ইউজ কি? থেরাপিউটিক বলো. Even after a nasal surgery, right, we use this instrument. Why? To see if there is any bleeding there, posterior nasal bleeding there, right? Okay. So therapeutic key to remove any foreign body, তাই তো? গলার মধ্যে কোনো foreign body? What foreign body is most common? Fish bone, তাই তো? Suppose there is a trauma, we need to stitch it out, we need to see the area properly. These are the uses of this instrument. পরের দিন আরো ভালো করে বলা হবে. This is a laryngoscope, হ্যাঁ? Generally post graduation এ দেওয়া হয়, still you have an idea. Okay? Direct laryngoscope, suspension laryngoscope we call it. Okay? We use this instrument to do the microlaryngeal surgery. ঠিক আছে? এটারও ভ্যারিয়েন্ট আছে, just see this. Anesthesiaতে ম্যাকিনটস laryngoscope তো দেখেছিস, ঠিক আছে? Anesthetic laryngoscope. This is different, okay? Another instrument, bronchoscope. ঠিক আছে? অনেক সময় দেওয়া হয় bronchoscope আর esophageoscope. You just need to differentiate it. দেখ বারবার ছবি দুটো দেখ. Can you see any difference between these two? This is a bronchoscope, this is a esophagoscope. Pore আছে. For what? হ্যাঁ, bronchoscope তে এই pores গুলো আছে, holes, তাই তো? এই কি পারপাস এটা? What is the purpose of this? আইডেন্টিফাই করতে পারবি তো? শিওর? ওকে, আইডেন্টিফাই করতে পারলে অনেক কিছু, ওকে? দেখ এখানে অনেকগুলো পোর্ট আছে, হ্যাঁ দেখ এখানে কি পোর্ট আছে, এখানে একটা লাইট সোর্স লাগানোর পোর্ট আছে আর ভেতর দিয়ে তোর যা করা হবে, ওকে? আর এই এটা জাস্ট টু হোল্ড দ্য esophagoscope we sometimes attach another instrument, okay? And here you can have many ports, see? তাই তো? এখানে একটা পোর্ট আছে, এখানে একটা পোর্ট আছে, এখানে একটা পোর্ট আছে, এখানে একটা পোর্ট আছে, তাই তো? One is used for ventilation purpose, one is used to see, right? One is used for suction, okay? And there are these holes, right? এইটুকুটা পারলেই হবে, আইডেন্টিফাই করতে পারবি তো? So rigid bronchoscope we call it, okay? So rigid bronchoscope, what is the use? Bronchoscope, scope means to see, broncho means to bronchus, to see the bronchus, তাই তো? lower airway, right? তো bronchoscope এর কি কাজ? Rigid bronchoscope mostly used for therapeutic purposes, but we can use it for other purposes as well, but mostly to remove a foreign body. ঠিক আছে? বুঝতে পারছিস তো? বাদাম খেতে খেতে বাঁশি বাজাতে গেছিল, বাঁশি টানতে গেল, বাদাম চলে গেল শ্বাসনালীতে, ওকে? সো কি হবে? সঙ্গে সঙ্গে এসে তারপরে ব্রঙ্কোস্কোপি করে বার করতে হবে, রাইট? But for only diagnostic purpose, with or without taking a biopsy, we can use a fiber optic one. ঠিক আছে, একদম ফাইবার অপটিক ফ্লেক্সিবল ব্রঙ্কোস্কোপ দিয়ে জেনারেলি সেটা করা হয়। ওকে, বাট রিজিড ব্রঙ্কোস্কোপ ইজ অনলি মোস্টলি ফর ফরেন বডি রিমুভাল পারপাস। ব্যাস এটুকুটা বলতে পারলেই হবে। ওকে, ইসোফেগোস্কোপ, অবভিয়াসলি ইসোফেগাস সে কিছু ম্যানিপুলেশন ইন্টারভেনশন করার জন্য, তাই তো? So foreign body in esophagus, so foreign body esophagus is more common or foreign body in bronchus is more common? Bronchus is more common, esophagus is more common. Okay, এবার কেন কি ন্যাচারাল টেন্ডেন্সি সেটা পরে আবার বলা হবে নয়, ঠিক আছে? হ্যাঁ, বাট ফরেন বডি ইন ইসোফেগাস মোস্টলি বাচ্চাদের কয়েন, হ্যাঁ, ইটস এক্সট্রিমলি কমন and this will be given, the x-ray will be given in your exam. Okay, foreign body in esophagus. So esophagoscopy করে আমরা সেই foreign body we can remove it, right? Okay, and also for diagnostic purpose, again the same story, flexible upper GI endoscopy is better for only diagnostic purpose. Okay, to see whether there is anything there, any growth there or anything there. The flexible one is used for mostly diagnostic purpose and rigid one is mostly for foreign body removal therapeutic purpose. Okay, so what are the common foreign bodies in esophagus? Coin, meat bone, তাই তো? Sharp objects also, পেরেক, sorry, safety pin we call it, এগুলো কিন্তু খুব কমন, খুব বেশি ডেঞ্চার, especially in aged patient, right? Denture is extremely important because it's more difficult to remove it. Battery is also common, but battery nose is more common. Battery is another story. If you get a battery as a foreign body, আমি একটা ক্লাসে বোধহয় বলেছিলাম, you have to take it very very seriously. Okay, কোনো বাচ্চার if you get a battery in nose, you have to image even the chest and abdomen as well. You cannot have a battery anywhere in your body, okay, because of its damaging potential, right? Okay, esophagus আরো অনেক রকম ফরেন বডি পাওয়া যায়। sometimes মানে ফানি স্টোরি ইজ দেয়ার, একটা পেশেন্ট ওরকম ট্যাবলেট বলেছে আমার ট্যাবলেট গলায় আটকে আছে, তাই হয় নাকি? ট্যাবলেট কি করে আটকে দেয়? তো এমনিই চলে যাবে। ওকে, আলটিমেটলি we found that yeah, it's a tablet but not a tablet actually, it was a stone. So corruption is everywhere, that's it. Another thing, it's a tracheostomy tube, অনেকবার পড়ানো হয়েছে, metallic tube and flexible tube. Okay, you can see the cuff here, so it's a cuff tube, right? And this is Fuller's bivalve, sorry, Silver Jackson's tracheostomy tube, you will given the Fuller's bivalve tube, this one. Okay, বোঝা গেল? Got the impression? So this is PVC made with a cuff there, and here is there any cuff? No, it has an outer tube, it has an inner tube. না দেখাতে পারলে very difficult. There is a hole there, right? So what is the purpose of this inner tube? What is the purpose of this outer tube? Why this hole is there? These are the questions. Okay, very difficult. Anyway, এটা আমি দেখাবো পরের দিন। Okay, if you got it. And this is a tracheal dilator to dilate the tracheostome opening. Okay, tracheostomy যে ফুটোটা সেটাকে ডাইলেট করার জন্য। Okay, that will also be, this is our tracheal hook. Okay, this is also used in which operation? Tracheal hook, the common sense, tracheal hook in tracheostomy. Okay, এটা তো ক্লাসে পড়ানো হয়েছে আজকে সকালে। ওকে, দিস ইজ কোন স্টেজে লাগে? ট্র্যাকিওস্টমি আবার পড়াতে হবে এদের। দিস ইজ a sharp hook, বোঝা যাচ্ছে? এটা কোথায় কি পারপাসে লাগে? টু hold and retract the thyroid during dissection. বোঝা গেল? ওকে, ইনডিরেক্ট ল্যারিঙ্গোস্কোপি মিরর আর এটা পোস্ট নেজাল মিরর। ডিফারেন্স বোঝা যাচ্ছে? হ্যাঁ, ডিফারেন্স বোঝা যাচ্ছে? সবাই তো ছিল না। কি, what is the difference? The shape. Okay, and this is has a different shape, right? So this is to see the postnasal space or posterior rhinoscopy mirror. This is to see the inside the larynx, right? So what are the structures that is used you can see with this mirror? That will be the question. Question will be, what is laryngeal inlet? Okay, what are the structures you cannot see? Okay, why it is indirect? Can you see directly the larynx here? It's a mirror image, right? So it's an indirect laryngoscopy. A direct laryngoscopy direct দেখার জন্য কি ছিল? This one. Here you can see it directly, right? It will go inside the larynx and you can see it directly. Okay? This is the probe, সকালে যেটা বলা হলো. Okay, OPD instrument, tuning fork. That's it.